First Nations people living in our communities have a greater chance of getting COVID than the average Canadian. Jesuit, my name is Dr. Evan Adams. I'm from Tla'amin Nation and I live in my own community. I'm not in guest at anyone's territory. This is Tla'amin. Well, my job as the Deputy Chief Medical Officer at First Nations and Inuit Health Branch headquarters in Ottawa, part of Indigenous Services Canada, is to help with COVID and Indigenous peoples across the country.
Hi, Nona.
Hi.
Welcome.
And sometimes people mistrust the medical community because of racism or racist experiences that they've had in the past. We have lots of people, including chiefs and scientists and doctors who are Indigenous, who are watching over the process to make sure that everything is fine.
Well, today is a big day. We're here to get our COVID vaccination shot. We actually talked to our own doctors about this because of our health issues, and we got assurance from our doctors that this would be a safe thing for us to do, to get the COVID vaccinating shot.
Lately, ne salta ne keo at ahundo.
Partnership is probably the best way for us to be able to learn, to listen, to learn, and to incorporate different ways of thinking about this into the way that we then implement some of the things that we need to do in these circumstances.
There are 55 First Nations communities in our northern region. We have to come together with our partner, the Northern Health Authority, in regards to how do we plan a vaccine rollout that takes into consideration of our First Nations people that choose to live in urban settings.
What can that rollout look like? How can we be inclusive of the entire community? The very fact that those diverse groups of people came together, you know, the First Nations, the Métis, the urban Indigenous, as well as mainstream Northern Health, that to me is an act of reconciliation.
What
we needed to be looking at to create a clinic space that was really safe and inclusive, and inviting in of different Indigenous leaders from the Prince George Native Friendship Center, First Nations Health Authority, Métis Nation. I had a really rich opportunity to learn.
We're currently standing on the traditional unceded territory of the Lheidli people. This is the mass vaccination clinic for the Prince George area. My name's Ryan Dernbach. I work with Northern Health on the Indigenous Health team. We really brought all the partners together as we started planning this clinic.
To be vaccinated by having representative volunteers from all Aboriginal associations present here during the elders vaccination, a lot of the individuals, is that it made them feel more at home and more comfortable.
We have to work hand in hand. And even if we have different ideas and different ways and different teachings, but we have to embrace each other in a way to support each other. We're not going to go back in the past of historical history of colonization and everything that has happened, a bandage.
And wanting through that process to provide some teachings for our mainstream partners as well, in terms of how do we work in a way with Indigenous people that provides safety and trust.
Hukelas dada chowedanzat tsiao silatu denti.
And it's important that we listen to others, to the people we serve, as well as our partners in the First Nations Health Authority, the Métis Nation, the Friendship Centers, the people who live in Indigenous communities, and understand their experience and their way of knowing.
Thursday, yes, naje, danene, habalsat and naste haba, etsi, laliu, danene, lads uden.